My name's Rick Malyszek. I'm a general surgeon. I grew up in Scranton, Pennsylvania, working class family. Mom and dad worked all the time, so we were at a very young age kind of independent, and was there till most of the grade school, then moved to the Pocono Mountains in Pennsylvania and got experience of farming in small communities. So I have always been kind of attracted back to small towns kind of thing. So I came to Denison. I was always sort of a community general surgeon, which is what I always wanted to be, a community general surgeon. And spent many years in small towns being the only surgeon, 24/7, 365. Before I came here, I was the only general surgeon in a small hospital up in the mountains of Colorado for, I think, 12, 13, 14 years. Before coming immediately from here, I was in Valentine, Nebraska, a very small hospital. The only general surgeon at that hospital. Put a little extra stress. It was hard when we had sick patients to get them somewhere if they needed additional help. And I'm a general surgeon. I like to do a little bit of everything, but sometimes a smaller hospital we can't do the little bigger surgeries. I started looking around for a place, small town like this. The town I was in before here was a very small town. I changed my way of life. I said, well, where's there a place I can have a partner? And Dr. Wright's my partner, great guy. Anytime you need anything, hey, what can I do to help? And that's great. And I'm at this stage of my life where, I used to thrive on being up all night, take care of the sick of the sick. It's one of the reasons I went into general surgery, because you take care of the sickest people. And general surgery tends to take care of everything that nobody else wants to when nobody else wants to. And I used to think that was pretty empowering. But it's just nice to have a partner. So I looked around, and actually I was interviewing at another town, and I happened just to drive through this town. And I sort of spoken to Dr. Wright once, but I just said, hey, I'm driving through your town, can I stop and talk? And we stood out in the parking lot for 3.5 hours. When I applied to med school, I didn't know the process very well. I thought you just sent an application in, and I didn't know it. So when I applied, I just applied to 2 medical schools. In my first year, I got waitlisted, but didn't get in, and I just sort of said, okay, how do I do this a little differently? So I went for a master's degree and started to think about getting a PhD as well, and then got accepted to med school. And my first year of med school, I took one class. I took psychiatry, and that was it. So after my residency, I applied to the biggest places I could for surgery, and I got accepted as part of the University of Pennsylvania in Philadelphia. And I was already there. I was there for grad school, and so I did my training there, and my general surgery training. And after general surgery, went into active duty after 9/11 and did 4 years as a combat surgeon. I was in a 4th surgical team and an airborne unit, so they jumped out of planes, and did that for 4 years and got out and then went into private practice. So the most rewarding thing is just really seeing people get better. I mean, surgery can have a huge impact, and the turnaround of them getting better, I wouldn't say is immediate, but it's the beginning of the road. I think we have a great medical staff. I've worked in other places, and this is really special. The people here, I think we have a really good group of providers. I really haven't been disappointed with anybody. Hope nobody's disappointed with me. But they really lean on you when they need you, and they're just they kind of believe whatever you tell them. I'm not telling them lies, but well, I saw on Google that this or this. They really come to you, and they value what you have to say. I don't know what I would do with myself. I don't know what my wife would do with me after I do surgery. So, I don't know. I don't see me just retiring and going away, but hopefully there's a spot for me.